The Pediatric Surviving Sepsis campaign, the newer guidelines of 2026 have just dropped by, and there are some major changes that we as pediatric intensivists must know. Screening for sepsis. In 2020, systematic screening was suggested. However, in 2026, the recommendation is gone, and lactate is now strongly recommended for risk stratification. Antibiotics in shock still within first hour, but without shock, 2026 adds a key step: rapid evaluation first, then antibiotics within 3 hours only if concern persists. Two new antibiotics stewardship points. Procalcitonin is now advised against for routine de-escalation, and ID consultation is suggested for all bloodstream infections. POCUS is now recommended strongly to guide resuscitation, and SCVO2 gets a specific target for the first time. Aim for 70% and above when available. Vasoactive choices in 2020 between epinephrine or norepinephrine were preferred over dopamine as peripheral vasopressors. In 2026, there is no preference between epi or norepi. They are considered equivalent. In fact, some adult studies are also going for norepinephrine first. Peripheral vasopressors now formally recommended to start in double dilution. Fluid stewardship is now a dedicated thing. Prevent fluid overload and actively remove it when needed. This is a new and important shift in thinking, which also supports the ROSE protocol. Hydrocort in 2020 was favored. However, in 2026, there is no strong evidence and there's insufficient evidence for the same. Fever management also loses its recommendation because the evidence remains insufficient. Oxygen targets after intubation should be maintained around 88 to 92 and avoid hyperoxia as supported by the PICU trial. And sodium bicarbonate is a new topic but no recommendation and lacks evidence. 2026 introduces immune therapy evaluation to support immunoparalysis. Leukopenia and hyperferritinemia are now formally assessed, and molecular diagnostics get a mention, though not recommended. And two big additions for the long game: early rehab bundles are now suggested, and post-sepsis follow-up for long-term sequelae is formally recommended. 2026 guidelines are more nuanced, more cautious, and more holistic than 2020. Save this and share it with your team. Follow for more.